The sterile corridors of St. Jude's rarely saw such chaos. Mateo Rodriguez, a young construction worker, lay pale and still as doctors swarmed his gurney. Massive mediastinal hematoma, Dr. Dubois barked, compressing the aorta. Get Volkov. Now. Rookie nurse Zahra Al-Kindi, her uniform still crisp, stood by, her presence barely acknowledged by the frantic team. She meticulously checked equipment, her gaze sharp, missing nothing despite her quiet demeanor. Dr. Volkov, famed for his precision, arrived, his face etched with the gravity of the task, an urgent, thoracoscopic repair, a dance on the edge of a blade. A surgery that could go catastrophically wrong with one wrong move. Zahra watched him, watched Mateo, a faint tremor in Volkov's usually steady hand not escaping her notice. No one saw the flicker of recognition, the deep, almost primal calm behind Zahra's humble eyes. They saw only a novice. But Mateo's life, unbeknownst to them all, already rested on the invisible strength of this quiet observer, on a hidden past waiting for its moment to erupt into saving grace. The operating theater at St. Jude's hummed with a sterile, focused energy, a stark contrast to the chaotic emergency room Zahra had just left. State-of-the-art monitors glowed, casting a cool, blue light across the surgical team, their faces partially obscured by masks. Mateo Rodriguez, now intubated and draped, lay utterly still on the table, his young life suspended between the precision of technology and the skill of human hands. Zahra Al-Kindi, her movements economical and silent, moved between the instrument trolley and the anesthesia cart. She was a ghost in the machine, her tasks rote yet performed with an almost ritualistic exactness. Every sterile pack, every syringe, every looped suture was placed with purpose. The crisp white of her new nurse's uniform felt alien compared to the worn, blood-stained fatigues of her past, yet the intensity of the moment was chillingly familiar. This was a different kind of battlefield, but the stakes were just as high. Dr. Viktor Volkov, the celebrated cardiac surgeon, stood poised at Mateo's side, his gaze fixed on the large, high-definition monitor displaying the thoracoscopic view. His hands, usually renowned for their unwavering steadiness, held the long, slender instruments with a visible, albeit subtle, tension. He was a maestro, but even the greatest virtuosos could crack under the weight of an audience, and this audience was particularly discerning. Observing from a discreet distance, Dr. Aramis Dubois, chief of surgery, exuded an air of detached, critical assessment. His arms were crossed, his posture radiating authority and an almost palpable impatience. Beside him, Dr. Mei Lin, a rising star in cardiothoracic surgery, watched with hawk-like intensity, her dark eyes missing nothing. A formidable intellect, Mei Lin's ambition was as sharp as her surgical skills, and she saw every procedure as both a learning opportunity and a competitive arena. "Scalpel, please," Volkov requested, his voice a low, controlled rumble. Zahra, anticipating the need, had it ready. The initial incision was made with practiced grace, a small gateway into Mateo's chest. The thoracoscope followed, its lens offering a stark, internal landscape. On the main monitor, the internal view resolved. The lungs, normally a healthy pink, were partially obscured by the angry, dark mass of the mediastinal hematoma, throbbing menacingly close to the great vessels. The challenge was immediately apparent, accessing the bleeding source without disturbing the fragile, compressed aorta. Volkov began the meticulous dissection, his instruments dancing with precision. He cleared away delicate facial planes, pushing aside lung tissue with careful retractors, inching closer to the pulsating danger zone. Sweat beaded on his brow, catching the harsh overhead lights, despite the cool temperature of the ore. Zahra monitored Mateo's vitals on her own console. His blood pressure was stable, heart rate steady, but she noticed a slight, almost imperceptible dip in the central venous pressure, CVP, followed by a barely noticeable increase in heart rate variability. "Dr. Volkov," she began softly, her voice pitched to be heard by the lead anesthetist, "CVP just dipped slightly to 7, then recovered. Heart rate variability trending up by 1 point. Dubois scoffed from the periphery. "Nurse Al-Kindi, the anesthetist is perfectly capable of monitoring vitals. Focus on your instruments." Dr. Renuka Sharma, the anesthetist, gave Zahra a small, dismissive nod without taking her eyes from her own intricate array of screens. Normal fluctuations, nurse. The patient is stable. Zahra suppressed a sigh. She wasn't just reading numbers, she was interpreting the body's subtle language, a language she'd learned to understand intimately when machines were scarce and life depended on pure intuition. The slight dip, the variability, it was the body's early whisper of strain, a foreshadowing of impending volume shifts. Volkov, intent on the monitor, didn't acknowledge her. He continued, his movements precise, but Zahra noted a rigidity in his shoulders, a stiffness that hadn't been there earlier. He was struggling, not with technique, but with the immense psychological burden. She'd seen it before, and doctors on the edge of burnout, and soldiers facing an impossible choice. Suction, please, Volkov ordered. Zahra reached for the finer-tipped suction, anticipating its need for precise clearing. But Volkov was already extending his hand for the standard, larger bore suction. She hesitated for a fraction of a second. The larger tip, while faster, could be less precise in such a confined, delicate space, risking further trauma. Nurse? Volkov's voice was sharp, a hint of frustration. Zahra quickly handed him the larger suction. Apologies, doctor, she murmured, her eyes still on the monitor. As Volkov cleared a small pooling of blood, the wide tip momentarily obscured a critical landmark, a small, collateral vessel feeding into the hematoma. Zahra's eyes narrowed. That vessel. It seemed to be under higher pressure than it should be. Dr. Volkov, Mei Lin interjected, her voice devoid of emotion, you're approaching dangerously close to the left brachiocephalic vein. Keep your dissection superior. Volkov grunted, acknowledging her, and adjusted his angle. Mei Lin's observation was surgically astute, but Zahra had seen something else. The collateral vessel was not just in proximity to the brachiocephalic, it was pulsating with an unusual vigor, a subtle indication of a deeper pressure buildup. She felt a prickle of unease. The hematoma appears encapsulated, Du Bois commented, his tone suggesting the procedure was now largely under control. Good work, Victor. Maintain this steady pace. But Zahra didn't see stability. She saw a delicate balance, a fragile dam holding back a torrent. The tissue surrounding the hematoma, viewed through the scope, had a peculiar, almost translucent sheen. It was stretched taut, not just by the blood within, but by something else, something she couldn't quite pinpoint. Her field experience screamed pressure. Not just mechanical, but vascular. She took a small step closer to the monitor, her eyes scanning every pixel of the magnified internal view. Volkov was about to incise the wall of the hematoma, a critical step to evaluate the clotted blood and identify the source of the bleeding. He paused, his instrument hovering. Dr. Volkov, Zahra began again, her voice low but insistent, the distal wall of the hematoma, superior aspect, it appears unusually distended. Perhaps a more controlled aspiration before incision? She didn't want to call it a false aneurysm or a pseudoaneurysm, that would be overstepping. But the morphology was wrong. This time, Mei Lin turned to Zahra, a flicker of irritation in her eyes. Nurse Al-Kindi, Dr. Volkov is fully aware of the morphology. We don't need armchair diagnostics from the scrub nurse. Du Bois chuckled, a dry, humorless sound. Indeed, nurse. Let the surgeon do his work. Volkov hesitated for a moment longer, his gaze fixed on the anomaly Zahra had pointed out, then he seemed to dismiss it. The pressure of his colleagues, the unspoken expectation, was immense. It's a robust capsule, he muttered, more to himself than to the room. We need to get inside. He prepared to make the crucial incision into the hematoma wall. Zahra felt a cold dread settle in her stomach. Her instincts, honed in conditions where protocols were a luxury and improvisation a necessity, screamed dissent. That robust capsule was a powder keg, and Volkov was about to light the fuse. The tension in the room, previously a steady hum, began to tighten, like a wire drawn taut, on the verge of snapping. The quiet precision of the procedure was about to shatter. Volkov steadied his hands, the microscopic camera feeding a high-definition image to the monitors. His pronouncements about the hematoma's robust capsule had silenced the room, including Zahra. He grasped the thoracoscopic scissors, their fine blades gleaming, and made the first, confident incision into the tense, purplish wall of the massive mediastinal hematoma. For a heartbeat, nothing happened. Then, a dark, viscous ooze pulsed from the cut, quickly followed by a geyser. It wasn't just blood, it was a torrent, a violent expulsion that immediately obscured the surgical field, painting the camera lens a shocking, opaque crimson. The pressure inside the hematoma, previously compressing Mateo's aorta, had been immense, and Volkov's incision had breached its fragile containment. The robust capsule was anything but. It had been a thin, distended membrane, holding back a catastrophic reservoir of blood under arterial pressure. Blood! Volkov gasped, his voice cracking, the confidence draining from him like the lifeblood now gushing from Mateo's chest. He recoiled slightly, the instruments momentarily forgotten. Suction! Get more suction! Dubois barked, rushing forward, his previous smirk replaced by a mask of alarm. Dr. Volkov, seal that. We're losing him. But it was too late. The mediastinum, already swollen and constricted, now became a chaotic maelstrom. The high-volume aspirator struggled to keep pace, its rhythmic slurping drowned out by the audible, violent surge of blood. Zahra, eyes fixed on the main monitor, saw the patient's vitals plummeting. The anesthetist's frantic voice cut through the growing panic, systolic pressure dropping. 190, 75. Heart rate tachycardic, SpO2 at 88. Volkov, still clutching the instruments, stared at the monitor, his face ashen. He was seeing not just blood, but his reputation, his control, his entire career, gushing away. He tried to advance the coagulator, a desperate, fumbling attempt to cauterize the unseen source, but the sheer volume of blood made it impossible to identify the bleeding point. The mediastinum, a tight, unforgiving space, was rapidly filling, threatening immediate cardiac tamponade. He's bleeding out internally. Mei Lin's voice, usually sharp and precise, was edged with genuine horror. She moved to Volkov's side, her gloved hands hovering, unsure of how to intervene without bumping him. Dr. Volkov, you need to find the source. We need direct pressure. But Volkov was paralyzed. His grip on the instruments slackened. His eyes darted wildly, unfocused, a deer caught in headlights. The precise, methodical surgeon had dissolved into a panicked shell. He was breathing heavily, his chest heaving under his scrubs. He had frozen. Chaos erupted around the table. Nurses scrambled for more suction canisters, for gauze packs, for everything they could think of. The anesthetist called out, massive transfusion protocol initiated. Blood bank on standby, cross-match confirms O-negative ready. Pressure 60/40. Patient is crashing. Damn it, Volkov, do something. Dubois roared, pushing past Mei Lin, his face contorted in frustrated fury. He reached for the instruments himself, but Volkov remained rigid, blocking the access, his gaze locked on the crimson hurricane on the monitor, unable to move, unable to think. He was a statue of despair. The sheer volume of blood loss was terrifying. Zahra, who had been positioning herself subtly, observing the deepening crisis, felt the familiar surge of adrenaline she hadn't experienced since her last deployment. Her mind, however, was icy calm. While everyone else was reacting to the horror, she was analyzing it. The position of the initial incision, Volkov's previous hesitation, the morphology she had glimpsed, it all clicked. The hematoma wasn't just a simple sac, it was a pseudoaneurysm off a great vessel, likely the aorta itself, or a major branch, contained by weakened tissue. Volkov hadn't cut into a robust capsule, he'd breached a highly pressurized, fragile wall directly connected to the arterial system. The only reason Mateo hadn't bled out instantly was the hematoma itself had been exerting counterpressure. Now that was gone. Mateo's stats continued their free fall. Pressure 30/20. Cardiac arrest imminent, the anesthetist yelled, desperation in his voice. Du Bois, seeing Volkov utterly unresponsive, finally shoved him aside, grabbing the thoracoscopic instruments. But he, too, was met with a wall of blood. He jabbed blindly with a long vascular clip applicator, trying to clamp something, anything, but it was futile. The field was completely obscured. He was just adding to the chaos. "He's gone, damn it. He's gone." Du Bois cried out, his voice a guttural roar of defeat. But Mateo wasn't gone. Not yet. Zahra moved with a silent, determined grace. Her eyes, usually so modest and unassuming, now burned with an almost terrifying intensity. She was no longer Zahra Al-Kindi, rookie nurse. She was the field medic who had once sewn up a ruptured femoral artery with dental floss and a fishing hook in a dust storm. She reached for the instrument cart, not for suction, but for a specific, delicate pair of long-handled grasping forceps and a fine-gauge vascular suture. Her movements were fluid, economical. She stepped directly in front of Du Bois, her quiet presence a stark contrast to the unfolding disaster. Du Bois, mid-curse, turned, his furious gaze landing on her. "What the hell do you think you're doing, nurse?" Zahra's voice was calm, steady, cutting through the din like a scalpel through tissue. Her eyes, however, held an unwavering authority that silenced even Du Bois for a split second. Asterisk asterisk I'll take it from here, asterisk asterisk. The words hung in the air, a shocking declaration amidst the chaos. Maylin gasped. Du Bois's jaw dropped, a mixture of outrage and disbelief contorting his features. "You'll take what from where, Nurse Al-Kindi? Have you lost your mind?" "He's got minutes, Dr. Du Bois." "We don't have time for this," Zahra stated, her hand already reaching for the patient's side, her resolve as sharp and unyielding as tempered steel. The critical precision of the procedure was shattered. A new, terrifying urgency had taken its place. Zahra ignored Du Bois's sputtering rage, her gaze fixed on the monitors, her mind already mapping the failing anatomy. "The mediastinal hematoma is tearing further. I need a specialized microsuture kit and an immediate bypass setup. My plan is unorthodox, based on instinct from critical field scenarios, but it's our only chance." She spoke with a quiet authority that defied her position. Du Bois roared, "This is madness. You're a nurse, not a surgeon." But Zahra's focus was unwavering. Mateo's life hung by a thread, and it was up to the quiet rookie to save him. Will this underdog's audacious gamble pay off? Don't miss a beat of this thrilling medical drama. Subscribe now to witness Zahra's incredible fight against the odds. The words, "I'll take it from here," echoed in the surgical theater, carving a bizarre silence out of the preceding chaos. Dr. Du Bois, his face a mask of furious disbelief, was about to launch another tirade when Zahra moved. Her hand, steady and purposeful, was already reaching for a long, curved DeBakey forceps on the instrument tray. She wasn't asking, she was acting. "Are you insane, Nurse Al-Kindi?" Du Bois roared, stepping forward, his bulk threatening to engulf her. "This is a level 1 trauma, a thoracoscopic repair on a massive mediastinal hematoma. You are a nurse. What in God's name do you think you're doing?" Zahra didn't flinch. Her gaze, cool and unwavering, met his. "What I'm doing, Dr. Du Bois, is preventing Mateo Rodriguez from exsanguinating on your table. His systolic is now 60 and trending down. His SpO2 just dropped to 78. That's not a trend, it's a plunge. Dr. Volkov is compromised. We have approximately 90 seconds before irreversible brain damage, maybe less." Her voice, though calm, carried an undeniable urgency, an authority that seemed to emanate not from her rank, but from the raw, stark reality of the monitors blaring in the background. The rhythmic beep-beep-beep of the heart rate monitor was accelerating into a desperate staccato, a death knell in progress. Du Bois faltered, his eyes flicking to the monitors, then back to Zahra. He saw the numbers, the grim truth of her assessment. Yet, his ingrained hierarchy, his professional ego, fought against it. "You're untrained. Unlicensed. You touch that patient, nurse, and you'll be facing a malpractice suit that will end your career, if not land you in prison." His ascending aorta has a 3 centimeter longitudinal tear, distal to the origin of the innominate, Zahra stated, her voice cutting through his threats like a laser. The initial clips failed because the aortic wall is friable from the blunt trauma, not just the pressure. Standard primary repair will tear through. We need to create a temporary buttress using pericardial tissue, secured with a specific interrupted suture pattern to distribute the tension, then reinforce with a finer running suture. A patch is too slow and will fail under this pressure. She wasn't speculating, she was diagnosing with a precision that chilled Du Bois to the bone. Her explanation, delivered without a single or ah, was clinically impeccable, detailing a strategy far more nuanced than simply clamping and stitching. It was a battlefield solution, born of necessity and acute observation, not textbook dogma. Mei Lin, who had been observing with a clinical detachment that belied the terror gripping her, felt a jolt. She was competitive, yes, but she was also a surgeon of exceptional intellect. She understood the intricacies of cardiovascular repair, the delicate balance of tension and integrity. Zahra's assessment of the friable aortic wall and the proposed solution, a pericardial buttress with a specific interrupted suture pattern, was unconventional, even radical, but it made sense. It addressed the fundamental problem Volkov's approach had missed. It was a high-risk maneuver, but far less risky than doing nothing. Her gaze swept from the plummeting vitals on the monitor, the SpO2 now dipping below 70, the profound bradycardia setting in as the heart began to fail from lack of perfusion, to Volkov, who remained slumped, his eyes vacant, his instrument still gripped in lifeless hands. Then to Du Bois, whose bluster now seemed to be a desperate attempt to assert control over a situation that had already spun beyond his grasp. Finally, her eyes locked onto Zahra. The rookie nurse stood there, radiating a fierce, quiet competence. Her hands, still unloved, were absolutely steady. There was no hesitation, no fear, only an intense, singular focus. Mei Lin, for all her arrogance, was a pragmatist. The patient was dying. Volkov was out. Du Bois was a screaming distraction. And Zahra Al-Kindi, a nurse, was presenting a viable, albeit insane, solution. Nurse Al-Kindi is right, Dr. Du Bois, Mei Lin's voice, sharp and clear, sliced through the tension. It was the first time she'd spoken since the crisis erupted, and her words carried the weight of her formidable reputation. His pressure is inadequate to perfuse the brain. We have zero time for protocol. Volkov is incapacitated. Mateo will not survive another minute under current management. What is your alternative, Dr. Du Bois? To stand here and watch him die? Du Bois recoiled as if struck. My alternative is proper procedure. To wait for Dr. Sterling to arrive, or for Dr. Volkov to regain composure. Dr. Sterling is 30 minutes away, trapped in traffic, and Volkov is not regaining anything, Mei Lin countered, her tone icy. Look at him. He's catatonic. And look at Mateo. His heart rate is dropping further. You want to adhere to protocol, fine. You'll be adhering to the protocol for declaring time of death. She stepped deliberately past Du Bois, placing herself between him and Zahra. Her decision, though agonizing, was clear. The life of the patient superseded all else. This was a Hail Mary pass, a desperate gamble, but it was a gamble with a plan, unlike the certain doom awaiting Mateo otherwise. Nurse Al-Kindi, Mei Lin said, her voice softer now, but firm, her eyes boring into Zahra's. What exactly do you need? And can you truly do this? Zahra met her gaze, a flicker of appreciation in her eyes for the unexpected ally. Yes, doctor. I can. I need immediate access to the pericardium for harvest-specific suture and a second pair of hands for retraction when I begin the primary repair. And Dr. Volkov's instruments. She gestured to the forceps still clutched in the lead surgeon's hand. Mei Lin didn't hesitate. Assistant, retrieve the forceps from Dr. Volkov. Someone get Nurse Al-Kindi scrubbed and gloved immediately. Set up for pericardial patch harvest. Nurse Al-Kindi, you are clear to proceed. Dr. Du Bois, you are now on standby for retraction, and you will assist precisely as directed by Nurse Al-Kindi. Any further interference, and I will personally ensure your surgical privileges are revoked for dereliction of duty. The words were a bombshell. Du Bois, stripped of his authority, stared, aghast. But the force of Mei Lin's command, coupled with the undeniable truth of Mateo's fading life, finally broke through his arrogance. He clamped his mouth shut, a vein throbbing in his temple. Within seconds, the oar shifted from paralysis to purpose. An assistant gently pried the forceps from Volkov's limp fingers and handed them to Zahra. Another nurse, moving with practiced efficiency, helped Zahra into fresh gloves, her hands already sterile from earlier scrubbing. The moment the latex snapped into place, Zahra took a deep, steadying breath. She reached for the thoracoscope, adjusting its angle with practiced ease. Her eyes, magnified by the surgical loops now brought into focus, narrowed, scanning the monitor. The bloody field was horrifying, a deep crimson pool obscuring much of the view, but Zahra's vision seemed to cut through it. She knew where to look, what to ignore, what was truly critical. Suction, she commanded, her voice calm and clear. Full power. Keep the field clear, just distal to the tear. Assistant, ready a 4-0 polypropylene suture, taper needle. Mei Lin, I'll need you to retract the left lung, gently, to expose the lower pericardium. Her words were no longer a plea or an assertion, they were instructions, precise and non-negotiable. The chaos had dissipated, replaced by a new, almost terrifying order. The weight of Mateo's life, balanced precariously on the edge of a scalpel, now rested in Zahra's steady, experienced hands. Her past, once a hidden secret, was now her greatest asset. The transformation was complete. The rookie nurse was gone, replaced by the battlefield medic, honed by impossible circumstances, ready to defy the impossible once more. The air in the oar, once thick with panic, now hummed with a different kind of tension, a profound, disbelieving silence. Zahra Al-Kindi, her face a canvas of unwavering focus, had seized control. The instruments in her hands, extensions of her will, moved with a fluid grace utterly alien to the frantic movements that had preceded her. Suction, Zahra repeated, her voice cutting through the lingering echoes of chaos. Full power. Keep the field clear, just distal to the tear. The scrub nurse, Dr. Miller, still trembling, obeyed, advancing the endoscopic suction probe. On the enormous overhead screen, the crimson deluge slowly receded, revealing the terrifying landscape within Mateo's chest. The descending thoracic aorta, a vital conduit of life, bore a gruesome, ragged laceration, a jagged tear almost half an inch long, just proximal to the diaphragm. It wasn't a clean cut, it was a high-pressure rip, the edges frayed and threatening to give way further with every desperate, fluttering beat of Mateo's heart. Dr. Du Bois, chief of surgery, stood rigid, his initial outrage now curdling into a mixture of disbelief and impotent fury. She's insane, he hissed to Mei Lin, his voice barely a whisper. This isn't how you repair a major vessel. This is improvisation at best. Recklessness at worst. Mei Lin, however, didn't respond. Her gaze was locked on the screen, on Zahra's hands. The rookie nurse, now commanding the endoscopic needle driver, moved with a precision and economy of motion that defied her apparent inexperience. There was no hesitation, no wasted movement. Each micro-adjustment of the instrument, guided by Zahra's preternatural calm, was purposeful, efficient, and imbued with an almost ancient elegance. 4-0 polypropylene suture, taper needle, ready, Zahra instructed, her eyes never leaving the monitor. I need excellent visualization. Assistant, gentle retraction on the tear margins, just enough to expose the healthy tissue. Dr. Ben Carter, the young resident acting as assistant surgeon, found his trembling hands steadied by Zahra's calm authority. He carefully maneuvered the endoscopic graspers, meticulously parting the blood-soaked edges of the wound, revealing the thin, elastic, yet terrifyingly vulnerable aortic wall. The tear is too wide for a simple primary closure, Mei Lin murmured, her surgeon's brain already racing through the implications. The tension would be too great. It would just pull through the tissue. As if reading her thoughts, Zahra responded without looking up. Agreed. This isn't a primary closure. We'll be using a continuous horizontal mattress, reinforced. A shoelace suture, if you will, to gather and distribute the tension. Du Bois scoffed audibly. A shoelace suture? What in the devil is that? This is an aorta, not a boot. But Zahra was already threading the needle. Her hands, guiding the endoscopic instrument through the tiny ports in Mateo's chest, began the first stitch. It was unlike any conventional technique Mei-Lin had ever seen for a vascular repair. Instead of a precise bite into the vessel wall aiming for direct apposition, Zahra took a wider, shallower purchase of the adventitial and medial layers, then brought the needle back through the same side, creating a horizontal loop on the outside of the vessel. The goal wasn't just to approximate, it was to buttress, to create a scaffold that would gather the tissue without direct tension on the fragile torn edges. She's creating a pseudopatch with the suture itself, Mei-Lin breathed, a flicker of something akin to awe, or perhaps horrified fascination, crossing her face. It's incredibly risky. If the tissue pulls, it's a full blowout. Precisely, Zahra said, her voice steady and even. But it also distributes the force over a wider area. In situations where graft material is unavailable, where time is critical, it's the fastest way to get a seal. We're not aiming for perfection yet, just containment. Each stitch was deliberate, a testament to Zahra's unique training. She didn't rely on the precise, preset angles or robotic consistency of a modern thoracoscopic setup. Her wrist movements were fluid, adapting instinctively to the confined space, the unexpected give of the tissue, the relentless, pulsating force of the blood. It was improvisation born of brutal necessity, honed in environments where standard tools were a luxury and every second was a gamble. The first few loops were agonizingly slow, each one seemingly defying the overwhelming force of Mateo's systemic blood pressure. A spray of blood still coated the lens intermittently, but with each carefully placed suture, the gushing became less of a torrent and more of a vigorous seep. Zahra adjusted her grip, her brow furrowed in concentration. Her movements weren't about textbook precision, they were about instinct, about feeling the tension of the tissue through the cold steel of the instruments, about knowing exactly how much pressure to apply to prevent further tearing without completely obliterating the lumen. Dr. Volkov, slowly regaining a semblance of composure, stood by the far wall, leaning against the counter. His eyes, wide and vacant, were fixed on the screen, watching his patient's life literally being restitched by a rookie nurse. He was seeing not just a procedure, but a ghost of his own early years, when medicine was more craft than science, more instinct than algorithm. But even then, he'd never seen anything quite like this. Du Bois, still fuming, edged closer to Mei-Lin. This is gross negligence. We should stop her now. This shoelace will never hold. The moment she ties it off, the pressure will blow it open. Look, Mei-Lin interrupted, her voice tight, a strange mix of skepticism and burgeoning respect. Look at the hemostasis. It's improving. The flow isn't stopping, but it's being channeled, contained. Indeed, with each pass of the needle, with each loop of polypropylene laid down, the massive hemorrhage was gradually, miraculously, coming under control. The sheer volume of blood in the field was visibly decreasing. The suction continued its relentless work, but it was now managing seeping rather than torrents. The ragged edges of the laceration, once splayed open, were being coaxed together, not directly, but through this unique, reinforcing lattice of suture. Zahra wasn't just closing a wound, she was rebuilding a wall. Her method was crude by St. Jude's immaculate standards, but undeniably effective. She was using a common suture material, polypropylene, designed for general vascular work but typically with finer techniques and dedicated patches, and turning it into a makeshift scaffold, a lifeline, for an artery under extreme stress. Another length of 4-0 polypropylene, taper needle, please, Zahra requested, her voice showing no signs of strain, only unwavering focus. And prepare to irrigate. I need to see if we have adequate hemostasis before we move to the final closure. The room remained silent save for the rhythmic beeping of the monitors, now showing a slow, agonizing improvement in Mateo's vital signs, and the focused hum of the instruments. The air, thick with the scent of blood and antiseptic, crackled with a tension that was now less about impending disaster and more about profound, astonished observation. No one spoke. No one dared. They watched Zahra Al-Kindi, the rookie nurse, performing what felt like a miracle with her bare, steady hands. Her past, her training, was unfolding before them, stitch by painstaking stitch. Zahra's voice, a calm island in the storm, sliced through the stifling quiet. "Irrigate, please." "Saline, moderate flow." The circulating nurse, still dazed, responded mechanically, manipulating the irrigation line. Warm saline flooded the thoracoscopic view, momentarily obscuring then clarifying the intricate landscape of Matteo's mediastinum. Blood clots, debris, and residual blood were meticulously washed away, revealing the repaired section of the aorta in stark relief. The 4-0 polypropylene, usually reserved for smaller, less volatile vessels or general tissue approximation, now stood as a testament to Zahra's radical ingenuity. It wasn't a patch, not in the traditional sense. It was a scaffold, a meticulously woven matrix of sutures, each placed with engineering precision, that had drawn the edges of the arterial tear together, reinforcing the integrity of the vessel wall without compromising its lumen. She had created a living, flexible mesh, a new architecture for the damaged aorta, leveraging the inherent strength of the surrounding, less compromised tissue. It was crude by St. Jude's pristine standards, brutal in its simplicity, but undeniably effective. Under the harsh surgical lights, a few tiny beads of crimson still wept from the immediate suture line, expected, given the nature of the repair and the immense pressure within the aorta. Zahra didn't flinch. Her eyes, magnified through the monitor, scanned every millimeter. A single interrupted 5-0 prolane on the tapered needle, just proximal to the last continuous stitch. Her request was precise, targeting a specific point of potential leakage. Dr. Maylin, who had unconsciously leaned closer to the monitor, recognized the maneuver. It was a supplementary stitch, a bailout often employed when a continuous suture line showed microleaks, but Zahra's placement was impeccable, almost intuitive, anticipating exactly where the stress might be highest. Maylin's competitive edge momentarily dulled, replaced by an unfamiliar, grudging respect. This wasn't just improvisation, it was an applied understanding of vascular mechanics that transcended textbook knowledge. Zahra executed the final stitch with the same unhurried dexterity. The fine blue filament disappeared into the tissue, emerging precisely where she intended, securing the final imperfection. She tied it off with a series of precise, endoscopic knots, her wrist movements economical, fluid. Each throw was deliberate, confident. "Suction, low setting," Zahra instructed. The assistant, a seasoned scrub tech named Brenda, moved the suction cannula into the field. The last vestiges of blood were drawn away, leaving the repaired aorta gleaming, pulsating rhythmically, now visibly less distended, no longer fighting against the immense internal pressure. The mediastinal hematoma, once a terrifying, suffocating mass, was receding, its pressure relieved. The anesthesiologist, Dr. Sharma, a man whose face had been a mask of grim determination for the past hour, let out a slow, controlled breath. Pressure stabilizing at 110/70. Heart rate 85, regular. Sats holding at 98. We're seeing a significant improvement in CO2 elimination. The acidosis is correcting. His voice, usually clipped and formal, held a tremor of disbelief. The change in Matteo's vital signs wasn't a sudden leap but a steady, undeniable ascent from the precipice. The chaotic, struggling waveforms on the monitor smoothed out, finding a new, stable rhythm. The urgent, frantic beeping softened into a reassuring thrum. Zahra leaned back slightly, her gaze still fixed on the screen, a silent sentinel ensuring her work held. She didn't offer a triumphant smile, no overt gesture of victory. Her expression remained neutral, focused. Only when a full minute had passed, and the monitor readings continued to hold their ground, did she allow a subtle, almost imperceptible easing of her shoulders. "I believe we have adequate hemostasis," she stated, her voice quiet but firm. "The pressure on the great vessels has been relieved. We can prepare for mediastinal drain placement and closure." The room, which had been holding its collective breath, now exhaled. It wasn't a cacophony of relief, but a deep, resonant hum, a silent acknowledgement of the impossible that had just occurred. Dr. Volkov, still pale and visibly shaken, finally moved, taking a tentative step forward. His eyes, wide with a mixture of shame and awe, darted from the monitor to Zahra. He couldn't speak, but his gratitude was palpable. Dr. Maylin, ever the stoic, pushed herself away from the console. She walked slowly towards Zahra, her expression inscrutable. For a moment, the room braced itself for a confrontation, a challenge. Instead, Maylin simply stopped a foot away, her intense gaze sweeping over Zahra's face, then down to her gloved hands, still poised and steady. The technique, Maylin began, her voice low, measured, it was unconventional. Highly so. There was no judgment in her tone, only clinical observation. But effective. Remarkably effective. Her eyes met Zahra's. For a fleeting second, a flicker of something akin to admiration, even respect, crossed Maylin's usually competitive features. She gave a single, firm nod. It was a silent validation, more profound than any spoken praise from the chief of surgery. Dr. Dubois, chief of surgery, stood rooted by the side of the room. His face, usually a canvas of arrogant confidence, was now a portrait of conflicted emotions. He had been so quick to dismiss Zahra, to threaten her, to uphold the rigid protocols of St. Jude's. Yet, before his eyes, a rookie nurse, without a scalpel in her hand, had saved a life that a renowned lead surgeon could not. The evidence of Mateo's stabilizing vitals was irrefutable, undeniable. His tightly clasped hands slowly unclenched. The words of condemnation, of legal repercussions, caught in his throat, replaced by a bitter pill of grudging recognition. Zahra, for her part, simply met Maylin's gaze, a hint of a ghost of a smile touching the corner of her lips. Necessity, she murmured, is a very stern teacher. She then calmly, methodically, began to unfasten her specialized thoracoscopic gloves. Her movements were precise, devoid of flourish. She wasn't looking for applause or accolades. She had done what needed to be done. The crisis was averted. Mateo Rodriguez would live. The surgical team, the nurses, the scrub techs, the junior residents, they all watched, transfixed, as Zahra peeled off her final glove, revealing hands that, moments ago, had held a life in their delicate, powerful grasp. There was a reverent silence in the operating theater, broken only by the steady, hopeful rhythm of Mateo's heart monitor. The true scale of her achievement began to settle upon them. It wasn't just a successful surgery, it was a paradigm shift. A raw, unadulterated display of skill that challenged every preconceived notion of hierarchy and expertise within St. Jude's elite walls. Zahra Al-Kindi, the quiet rookie nurse, had not just saved Mateo Rodriguez, she had irrevocably altered the landscape of their understanding. Her training, born not in sterile lecture halls but in the crucible of chaos, had proven to be a force unlike anything they had ever witnessed. The air in the OR, once thick with impending disaster, now hummed with a nascent, transformative respect. Excellent work, Nurse Al-Kindi, Dr. Sharma, the anesthesiologist, finally managed, his voice thick with emotion. It was the first direct compliment, formal and yet deeply heartfelt. Zahra inclined her head slightly, a gesture of humble acceptance. She then turned, her presence shrinking back from the central focus, allowing the team to prepare for the routine steps of drain placement and closure. Her job, the critical, life-saving part, was done. She was a nurse again, stepping back into her role, but the room knew, instinctively, that nothing would ever be quite the same. The seeds of a revolution had been sown, stitch by painstaking stitch, in the heart of St. Jude's operating theater. The remaining tasks of chest drain insertion and meticulous layered closure of the thoracoscopic ports were performed with renewed, almost reverent, efficiency by the assisting surgeons, guided by the now stabilized vitals. Dr. Volkov, still visibly shaken but re-engaged, found his footing again, directing the final stages with a newfound humility. He glanced repeatedly at Zahra, who now stood quietly by the instrument table, organizing the discarded supplies with calm precision. The magnitude of his own near failure, juxtaposed with her decisive action, hung heavy in the air, a silent lesson. As the last skin sutures were placed and dressings applied, a collective sigh of relief, audible this time, swept through the room. Mateo was off the table, medically speaking. He was still critical, requiring intensive post-operative care, but the immediate, life-threatening crisis had been unequivocally averted. Dr. Dubois, observing from a distance, remained impassive, his initial indignation having curdled into a grudging, almost painful acknowledgement. He knew, with a certainty that chilled him, that this event would reverberate through the hospital. His authority, his carefully constructed hierarchy, had been bypassed and, in a strange twist, saved by the very individual he had sought to reprimand. He would have to address this, but for now, the overwhelming success overshadowed any disciplinary concerns. Mei-Lin, however, wasn't so reserved. She approached Zahra again, this time with a more direct purpose. "Nurse Al-Kindi," she said, her tone sharp but devoid of animosity, "your hands. They are exceptionally steady. And your understanding of the anatomy under duress is remarkable. Where did you learn to do that?" The question, direct and clinical, cut to the core of Zahra's hidden past. Zahra looked up, her expression unreadable. In places where the rulebook was often written in sand, "Dr. Lin," she replied softly, her eyes holding a distant, weary knowledge. And time was always short. Mei-Lin absorbed this, her brilliant mind already drawing connections. Conflict zones. Improvised medicine. The pieces began to click into place. The raw, pragmatic efficacy of Zahra's technique made sense under that harsh light. It wasn't just a trick, it was survival forged into surgical art. "Indeed," Mei-Lin said, a faint, almost imperceptible smile touching her lips. "A stern teacher, as you said. One that few of us here have had the privilege to learn from." She paused, then added, with a decisive tone, "I want a full report on this procedure. Your specific steps, your rationale. Everything. For the hospital records. And for future reference." It was an order, but also an invitation, a tacit recognition of Zahra's unique contribution and a desire to understand and, perhaps, even integrate it. Zahra nodded. "Of course, Dr. Lin." She began to meticulously clean her workstation, her movements now reflecting a quiet closure. The drama was over, the emergency resolved. She was already mentally transitioning to the next phase of Mateo's care, ensuring the handover to recovery was seamless. Her calm was absolute, a testament to her resilience. As the team prepared to transport Mateo to the ICU, the atmosphere in the OR had profoundly shifted. The tension of crisis had given way to a palpable sense of triumph, but also a simmering undercurrent of change. Zahra Al-Kindi, the rookie nurse, had not only defied expectations, she had redefined them. She had forced St. Jude's elite, hierarchical world to confront the limitations of its own rigid structures and the untapped potential that often lay hidden in plain sight. The true implications of her actions, the tremors of a coming revolution and how talent was recognized and valued, were only just beginning to be felt. The hospital had witnessed a miracle, performed by the most unlikely of saviors, and its legacy would endure long after the last drop of blood had been cleaned from the polished floor. The profound silence that had fallen over Operating Room 7 was not one of despair, but of an almost reverent shock. Mateo Rodriguez's heart beat strong and steady on the monitor, a rhythmic drumbeat of life against the sterile quiet. Dr. Zahra Al-Kindi, hands still poised, not quite withdrawn from the surgical field, felt the thrum of that steady rhythm deep within her bones. She wasn't looking for applause or recognition. Her focus, even now, was entirely on the patient. Dr. Anya Sharma, the anesthesiologist, was the first to break the spell. Her voice, usually calm and measured, was tinged with a tremor of disbelief. "BP is 120/80, heart rate 72, saw 299%, he's stable." "My God, Zahra, he's stable." A collective, shuddering exhale swept through the room. The scrub nurse, Elena, lowered her gaze from Zahra's profile to Mateo's chest, her gloved hands trembling slightly as she began to meticulously count instruments. The junior resident, Dr. Chen, who had stood frozen in terrified observation, now found himself taking a deep, ragged breath. He looked at Zahra, then at the pulsating repair site, then back at Zahra, as if trying to reconcile the quiet nurse with the surgeon who had just wrestled a man back from the precipice of death. Dr. Mei Lin, who had been observing with a professional, almost cold, detachment, now moved closer to the table. Her eyes, usually sharp with critical assessment, were wide with a mixture of professional curiosity and a dawning, grudging respect. She leaned in, studying the repair site through the scope. The improvised bypass Zahra had fashioned, stabilizing the fragile aortic wall and shunting flow past the compromised area, was utterly audacious. It wasn't textbook, it was born of necessity, of battlefield ingenuity. Is that a reinforced 4-0 proline? Stabilizing the adventitial layer before the primary closure? Mei Lin murmured, her voice barely audible. It was less a question, more an astonished observation of the intricate, almost delicate, yet immensely robust repair. The sheer audacity of using standard vascular suture in such a novel, life-saving application was staggering. Hemostasis was absolute, the field was dry. No telltale ooze, no capillary blush. Just a perfectly orchestrated symphony of reconstructed tissue. Zahra finally withdrew her instruments, placing them gently in the basin. Yes, Dr. Lin. Combined with a pericardial patch for additional strength and to manage the intraluminal pressure differential. Aortic wall was too friable for a simple anastomosis. Her voice was soft, devoid of any triumph or self-congratulation, as if she were simply explaining a routine procedure. Mei Lin straightened, her gaze fixed on Zahra. For a fleeting moment, the brilliant, competitive surgeon's facade cracked. A slow, almost imperceptible nod passed between them. It was a silent acknowledgement, a professional salute across the chasm of their respective experiences. Mei Lin, who prided herself on being at the forefront of surgical innovation, had just witnessed an act of pure, unadulterated genius born from a realm she couldn't possibly fathom. The nod was hard-won, a concession that spoke volumes. But the moment of shared understanding was abruptly shattered by a booming, indignant voice from the doorway. What in God's name happened here? Dr. Aramis Dubois, chief of surgery, stood framed in the entrance, his face a mask of furious indignation, his eyes scanning the room as if an unspeakable crime had been committed. He strode in, his gaze settling immediately on Zahra. He had, of course, been informed of the initial catastrophic hemorrhage and Volkov's incapacitation. He had also been told that the patient had stabilized, but the details of how were still sparse and, to his mind, utterly inconceivable. Dr. Volkov, what is the meaning of this? Why is a nurse performing a highly complex cardiothoracic repair? This is a gross breach of protocol, a flagrant disregard for patient safety and medical ethics. Dubois's voice escalated, his fury overriding any sense of decorum or respect for the gravity of the moment. He saw not a life saved, but a system violated, his authority challenged. Dr. Volkov, still pale and visibly shaken, stumbled over his words. Dr. Dubois, I froze. The patient was crashing. Zahra, she saved him. There was no other choice. His voice was weak, defeated. Dubois dismissed Volkov with a contemptuous wave of his hand, his eyes returning to Zahra, burning with accusation. No other choice? There are dozens of qualified surgeons in this hospital, Dr. Volkov. You call an unlicensed, untrained individual taking over a catastrophic aortic repair no other choice. He spat the words unlicensed, untrained as if they were venom. This hospital runs on precision, on procedure, on expertise. Not on improvisation and blatant disregard for the chain of command. Zahra met his gaze steadily, her expression serene. The patient was exsanguinating, Dr. Dubois. Time was not a luxury we possessed for a consultation or a fresh surgical team. Every second was vital. Vital for you to play God, Nurse Al-Kindi? Dubois sneered. What possible training could you possess to justify such an egregious act? Your nursing degree? A few months of ER rotations? He was setting the stage, framing her as an rogue, an amateur, despite the evidence of Mateo's stable vitals screaming the contrary. Before Zahra could respond, a voice cut in, sharp and clear. It was Dr. Maylin. She didn't play God, Dr. Dubois. She performed an incredibly complex, successful repair of a massive mediastinal hematoma compressing the aorta. It was textbook-defying, yes, but undeniably effective. The patient is alive because of her. Maylin's defense, though concise, carried immense weight. She was a surgeon of unimpeachable repute, and her validation was not easily given. Effective? Dr. Lin, are you condoning unlicensed practice in my operating room? Dubois spluttered, momentarily flummoxed by Maylin's unexpected intervention. Elena, the scrub nurse, stepped forward, her hand still gloved, her voice trembling but firm. Dr. Dubois, you didn't see it. Dr. Volkov was paralyzed. The bleeding was immense. We were losing him. Zahra acted decisively. She knew exactly what to do. Her hands were steadier than any surgeon I've ever seen under that kind of pressure. She improvised a pericardial patch from available material. Her technique for shunting and repair, while unconventional, arrested a catastrophic hemorrhage that would have killed Mateo in minutes, added Dr. Sharma from behind her anesthesia machine, her own experience as a witness lending her words irrefutable truth. She didn't just take over. She saved him. The collective sentiment in the room was palpable, a united front against Dubois's vitriol. The residents, the circulating nurses, even the quiet instrument tech, all looked at Zahra with a mixture of awe and fierce loyalty. They had seen her perform a miracle. They had lived through the terror, and they would not stand by as her actions were dismissed. Improvised? Pericardial patch? What are you all talking about? Dubois demanded, looking from one face to another, his self-assured arrogance beginning to crack under the weight of so many earnest testimonials. He clearly hadn't grasped the specifics of the repair, only the fact that a nurse had done it. Zahra finally spoke, her voice still quiet, but with an underlying steel that commanded attention. My training, Dr. Dubois, was not from St. Jude's or any conventional institution. Before I became a nurse, I was a field medic. A hush fell over the room again. Dubois stared at her, momentarily speechless. I operated under far worse conditions in conflict zones, Zahra continued, her gaze unwavering. No ORs, no sterile fields, no specialized instruments, often no light. Just dying people and whatever I could find to keep them alive. Improvised vessel repair, emergency thoracotomies, limb salvages, under fire. It was my duty. That experience, I believe, is what prepared me for Mateo's situation today. The words hung in the air, transforming the image of the unassuming rookie nurse into something entirely different. Field medic. Conflict zones. The gravity of her past was suddenly laid bare, explaining the uncanny calm, the resourcefulness, the unparalleled skill. The hidden expertise was no longer hidden, it was a brutal, hard-earned reality. Dubois, finally, seemed to deflate slightly. The wind had been taken out of his sails. The context of her unlicensed practice had shifted from reckless insubordination to desperate, life-saving necessity, forged in the fires of war. It wasn't academic arrogance, but raw, visceral experience. He still looked furious, but the righteous indignation was now mingled with a dawning, unwelcome respect. Zahra didn't bask in the revelation. Her focus returned to Mateo. We need to close the chest and get him to ICU. Dr. Sharma, are you comfortable with his hemodynamics for transport? Her humility, even after such a staggering confession, was perhaps the most remarkable thing of all. She hadn't revealed her past to defend herself, but to contextualize her actions, to explain that she wasn't a rogue, but a trained professional from a different, far harsher, school. The hospital hierarchy, for all its rigid structure, had just been forced to confront a truth it hadn't anticipated. Sometimes, the most profound expertise comes not from polished titles and elite institutions, but from the crucible of desperate human need, and the quiet, unwavering courage of individuals like Zahra Al-Kindi. The battle for Mateo's life was won, but a new, quieter battle for recognition and change had just begun. The immediate aftermath of Mateo Rodriguez's surgery was a whirlwind of frantic activity, swiftly followed by a tense, watchful quiet. He was rushed to the cardiothoracic intensive care unit, TICU, where a specialized team took over his meticulous postoperative management. Zahra, after ensuring a stable handover, had quietly slipped away, leaving the lead roles to the designated professionals. But her absence from the bedside did not diminish her monumental impact. Mateo's recovery was, against all odds, remarkably swift. The delicate repair held, a testament to Zahra's improbable skill. Within hours, his arterial line pressure stabilized, the massive mediastinal hematoma visibly shrinking on follow-up CT scans. The pressors that had been pumping into him were gradually weaned. He remained intubated for the first 24 hours, his chest drained steadily evaluating residual serosanguinous fluid, but his oxygen saturation remained high, his heart rhythm sinus, and his vital signs slowly crept back into a stable range. On day 2, he was successfully extubated, his first hoarse whisper of gracias bringing tears to his worried family's eyes. Over the next week, he moved from TICU to a step-down unit, his chest tubes removed, his lungs re-expanding fully. The cardiothoracic team, initially shell-shocked by Zahra's intervention, now spoke of his recovery with a mixture of disbelief and profound relief. He would need extensive physical therapy, but he would live, and his aorta, once on the brink of catastrophic rupture, was whole. The consequences for St. Jude's medical elite, however, were far more complex and enduring. Dr. Viktor Volkov, the renowned lead surgeon, was granted an immediate, indefinite sabbatical. The official reason cited stress-induced exhaustion, a euphemism for the catastrophic panic attack he'd suffered mid-procedure. The incident, witnessed by an entire or staff, had shattered his carefully constructed professional facade. While the hospital administration handled it delicately, acknowledging his past contributions, the whispers in the corridors were brutal. Volkov, a man whose identity was inextricably linked to his surgical prowess, found himself adrift. He entered therapy, grappling not only with the trauma of freezing but with the agonizing realization that a rookie nurse had saved his patient and, by extension, his own reputation from utter ruin. His return to the operating theater, if it ever happened, would be under a cloud of doubt, his once unshakable confidence irrevocably shaken. Dr. Aramis Dubois, chief of surgery, bore the brunt of a different kind of professional humiliation. His attempts to discredit Zahra, his rigid adherence to protocol over life, had been exposed to an entire department. The internal review, while not resulting in his immediate dismissal, his political capital and tenure were too significant, was damning. He received a formal reprimand for professional conduct detrimental to patient care and was quietly stripped of several key committee appointments. More importantly, his authority had been publicly undermined. The residents and junior attendings, many of whom secretly chafed under his autocratic rule, now eyed him with a new, emboldened skepticism. Dubois, a man for whom perception was everything, found himself isolated, his reputation as an infallible leader irreversibly tarnished. He doubled down on bureaucratic processes, but the subtle shift in the hospital's power dynamics was palpable, the foundation of his unassailable command had fractured. Dr. Mei Lin, on the other hand, experienced a profound, if unwelcome, reevaluation. Her initial outrage at Zahra's defiance had curdled into a grudging, then outright, respect. Witnessing Zahra's impossible surgical feat, her steady hands and inventive solutions, had chipped away at Mei Lin's own surgical ego, forcing her to confront the limitations of traditional training. She was brilliant, but Zahra's battlefield pragmatism offered a dimension of surgical artistry she hadn't considered. Mei Lin became Zahra's most unexpected, and fiercely intelligent, advocate during the post-op interrogations, lending her considerable academic weight to validate Zahra's unconventional methods. It wasn't an easy transformation. Mei Lin was a born competitor, but she recognized true genius when she saw it, even if it came from the most unlikely source. The experience fundamentally altered her perception of what constituted elite medicine, opening her mind to a more adaptive, less dogmatic approach. The hospital administration, faced with overwhelming evidence of Zahra's heroic intervention and Mateo's miraculous recovery, could not ignore the truth. Led by a newly enlightened chief of staff and influenced by Mei Lin's impassioned arguments, they initiated a groundbreaking proposal. Zahra Al-Kindi was offered a newly created position, clinical innovator and rapid response trauma specialist. This wasn't a nursing role in the traditional sense, nor was it a surgical residency. It was a bespoke position, tailored to her unique skill set. She would be credentialed under special provisions, her extraordinary field experience recognized as an equivalent, albeit unorthodox, form of advanced medical training. Her duties would include 1. Leading a small, agile rapid response team for critical and hospital emergencies. 2. Consulting on complex, high-risk trauma cases, particularly those involving unconventional presentations or resource limitations. 3. Developing and implementing innovative, low-resource surgical techniques for disaster preparedness and remote medical aid scenarios. 4. Mentoring junior staff, sharing her insights on improvisation, diagnostic intuition, and calm under extreme pressure. It was a role that dismantled the traditional hierarchical lines, placing a nurse in a position of authority typically reserved for seasoned attending physicians. It was a radical shift, an acknowledgement that expertise could bloom outside the hallowed halls of academia and rigid specialty tracks. It challenged St. Jude's entrenched status quo, forcing the institution to redefine qualifications and competence. Zahra accepted, her humility as genuine as ever. She saw it not as a promotion or a vindication, but as an opportunity to save more lives, to bring the lessons of the field to a place where they could make a profound difference. She wouldn't be abandoning her roots. Instead, she would be expanding them, building a bridge between two disparate worlds of medicine. St. Jude's Medical Center, once a bastion of rigid hierarchy and conventional excellence, slowly began to evolve. Zahra's presence continued to ripple through its corridors, a quiet but persistent force. Her calm demeanor, her unerring instinct, and her willingness to challenge established norms became a new benchmark. She wasn't just a nurse anymore, she was a symbol, a testament to the idea that true healing often requires a courageous departure from the familiar, an embrace of unconventional wisdom, and the unwavering courage of individuals who dare to see beyond the rules, right to the heart of human need. Her story was far from over. The newly forged path she walked promised more high-stakes situations, more challenges to the status quo, and the continued, quiet revolution of a system learning to value its hidden heroes. Zahra's journey is a powerful reminder that true expertise isn't always found in grand titles or traditional paths. It's often hidden, forged in unexpected fires, ready to emerge when humanity needs it most. Her story at St. Jude's isn't just about one life saved, it's about a quiet revolution, proving that courage, intuition, and unconventional wisdom can shatter norms and redefine heroism. What did you think of Zahra's incredible journey? Which moment resonated with you the most? Share your thoughts in the comments below. If you're inspired by stories of hidden heroes and transformative change, don't forget to like, share, and subscribe for more thrilling narratives. Let Zahra's spirit remind us all, sometimes, the greatest strength lies in the most unexpected places, waiting to make an extraordinary difference.